Hey guys, this is Dr. David Stoker in Los Angeles with a great looking case. Check it out. She's a 35-year-old physician who came to me for a rapid recovery breast augmentation and bilateral inverted nipple repair. We can't show you the nipples, however, they look perfect. You can't see the incisions at all. And you can't even really see the incisions on the breast, the inframammary incisions each side. We use 350 cc moderate profile cohesive silicone gel implants on side. And let me just ask our physician patient here, how was your rapid recovery afterwards? Could you have gone back to work the next day?
Yep, I definitely could have gone back to work within 2 days, and probably the day after the operation. 2 days later I was walking. I had to curtail myself. I was walking too much. It just was too easy, so pretty much no limitations on my daily activities.
And how do you feel about the results? Are you elated?
Beyond elated. I could never have imagined that they were going to look this good, both procedures.